Hi, everyone, and welcome to Buckeye Nation. I am so excited that you have come on board with us as new faculty. And while you're here with us, we want to keep you in optimal health and well-being so you can be as successful as you can possibly be. I'm Bernadette Melnyk, and I have the privilege of serving as Ohio State's Vice President for Health Promotion, the university's Chief Wellness Officer, and Dean of the College of Nursing. Well, even before the pandemic hit our country, we had a major public health epidemic of burnout, stress, and depression. Everyday Health conducted a study last year, and they actually titled it The United States of Stress, because the stress of Americans was off the roof. The generation that reported the highest stress was Generation Z. That's our college student population. Well, then the pandemic hit in March, and now the latest studies show that 1 out of 3 Americans are suffering from a lot of psychological distress. We are here at Ohio State to help all of our faculty, staff, and students to maintain a high level of mental and physical well-being. When the COVID pandemic hit us in March, we pulled our entire wellness team together to really ramp up our wellness offerings even more throughout our university. I also created an acronym to help our faculty, staff, and students with tactics that could help them during the pandemic. C stands for control the things you can, not the things you can't. Open up and share your feelings. Practice daily stress reduction techniques, including physical activity. Activity is not only good for our physical health, but can help us to reduce our stress, anxiety, and any depressive symptoms we might experience. Engage in mindfulness. Be here now, because worrying about the future will not help. Count our blessings daily. An attitude of gratitude has been supported by research to really allay stress, anxiety, and depression. Overturn negative thoughts to positive. In fact, when we feel ourselves getting more stressed, anxious, or depressed, we have to stop ourselves and say, what was I just thinking? And is that really true? Learning these cognitive behavioral skills really helps us achieve optimal mental well-being. Volunteer to help others. Identify helpful supports and resources. And finally, we have got to do our part to prevent the spread of the virus, including great hand washing for 20 seconds, physical distancing of 6 feet, and wearing masks. We released a Stay Calm and Well series, part 1, that took place from March through May. It was a weekly 30-minute series for our faculty, staff, and graduate students. That was so successful. We had over 3,000 people sign up for that series. And now we're going to launch a part 2, Stay Calm and Well. The registration link is on this slide. I hope that you will participate in that series. We also produced a guidebook, and we are one of the only universities in the country that included mental health, physical health, and well-being in our Safe and Healthy Buckeye materials. Please go to this website, check out the guide. It is so helpful, contains lots of wonderful resources on how to stay calm, well, in optimal well-being during your time with us. So I left sunny Arizona almost 9 years ago for this pioneering position of being Ohio State's first Chief Wellness Officer. I grew up in a small coal mining town that you can see on the slide in southwest Pennsylvania, near the West Virginia border. My mom and dad were loving parents. My dad was a coal miner. We lived in a half of a little company house. But I was born with rose-colored glasses on. I still can make lemonade out of lemons any day. So I was a happy child until 15 years of age, home alone with my mom when she sneezed and stroked out and died right in front of me. You can imagine how traumatic that was for me at the age of 15. But what was really sad about my mom's story, she had a history of headaches for well over a year. And my dad kept saying, please go to the doctor and figure out what's wrong. She went to our family physician just 1 week before she died, was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. I think now you can understand why I'm so passionate about wellness and prevention. Sadly, my dad had his heart attack when I was 19. All that, though, what I experienced as an adolescent only fueled my passion to become a nurse practitioner, go on to get my PhD so that I could develop and test interventions to improve the health and well-being of vulnerable children, teens, and young adults. I'm really blessed that I have the opportunity with a fabulous team to ensure that our faculty, staff, and students have what they need here at Ohio State to lead lives that are fully engaged and well. It's wonderful that Ohio State was the first university in the country to appoint a chief wellness officer. Since my appointment, other universities have recognized the importance of this role for their population's well-being and have started to appoint CWOs. Well, at Buckeye Nation, we consider wellness to be the optimal state of living well, regardless of where somebody is at on the spectrum of health. We also focus on 9 dimensions of wellness because not everyone needs the same resources and programs at the same time. What I really want to emphasize today is that self-care is necessary for full engagement and great care of others. Here at Ohio State, we want you to engage in wellness programming. We want you to take good self-care. You cannot pour from an empty cup. So we encourage you, take time, little snippets out of every day to get up and move, to engage in some of the great programs that we have. Your taking good self-care will result in you being happier, healthy, fully engaged with our students, with our colleagues. So please hear this message. We want you to be in optimal state of health and well-being, and we're here to help you with that. So Ohio State's vision, and we are really serious about this, is to be the healthiest university and community on the globe. We exist to facilitate the highest level of wellness for faculty, for staff, and students across the university and community. We have a philosophy: in God we trust, but everybody else better bring data to the table. We consistently make evidence-based decisions. In 2019, we created our new 5-year university health and wellness strategic plan. These are our 4 main goals, but you can review the entire strategic plan at my Chief Wellness Officer website. Cardiovascular disease still remains technically the #1 killer of Americans. However, if we consider all causes of death and disease in the United States, behaviors are our #1 killer, including physical inactivity, unhealthy eating, smoking, drug and alcohol abuse. But there's another behavior that contributes to especially cardiovascular disease, and that is the chair. So please beware of your chair. We have studies that show if we sit 3 hours a day, we're going to increase our cardiac risk by 30%. If we sit 5 hours a day, that is comparable to smoking 1.25 packs of cigarettes every day. You heard my history, bad cardiovascular genetics. I could say, I'm going to die young anyway, so I'm not going to exercise, I'm not going to eat healthy. What good is that? However, this population health study of 1 million people showed, more than our genes, more than our social circumstances, more than the health care we receive. It's our behaviors that are the leading predictor of whether we will die young or not. Sadly, 1 out of 2 people in our country have a chronic disease, but 80% of chronic disease can be prevented with just a few healthy lifestyle behaviors. Take a hard look at this slide. This is a fitness facility in the state of California, and you have a choice. You can either walk the stairs or take the escalator to go work out. A group of psychologists studied how many people during the course of a day, during the course of a week, would choose to take the stairs instead of the escalator. Sadly, only 2 people a day. So again, when we're confronted with choices, let's choose the healthier option. If I had to give you an evidence-based recipe on how you can cut your risk of chronic diseases by this much, here's all you have to do. Physical activity, 30 minutes, 5 days a week. You might say, Bern, I could never get in 30 minutes a day of physical activity. Here's how you can do that while you're working. Cut your meeting times down. Instead of 60 minutes, have 50-minute meetings. People will get through your meetings in the time you've allotted. Take that extra 10 minutes and say, I'm going to get up, take a brisk walk around my building, or I'm going to walk the stairs, or I'm going to do 5 minutes of jumping jacks. Break up your minutes. 30 minutes a day is very doable if you do that. 5 fruits and veggies a day. Don't smoke. If you don't drink alcohol, do not start now. But if you do, limit it to 1 drink a day for both males and females. A lot of people then ask, when I share this evidence, Bern, how big can that drink be? And I say, not the size of the alcoholic beverages we get in Vegas. It has to be a single serving. The Centers for Disease Control did a study in 2016 that showed only 6% of adults engage in these very important health behaviors. We have the evidence-based recipe. It's simple, but it's not easy. It takes 30 to 60 days to make a behavior change. So I want you to consider today as January 1. It's New Year's Day. And I would like you to make a commitment to get just a little better at one of those behaviors that I just highlighted. If you only engage in activity 2 days a week for 10 minutes a time, make your goal realistic for the next 30 days. Say, I'm going to increase that to 15 minutes 2 days a week. When you reach that goal, inch it up a little bit more. So we've got a big wellness team here at Ohio State. From my office as Chief Wellness Officer to HR, your plan for health, our health plan, an employee assistance program, and our terrific grassroots Buckeye Wellness and Buckeye Wellness Innovators. We implement evidence-based interventions, things we know work from research. We target them to the grassroots, individuals and small groups, to supervisors and managers, to top leaders, to our system. We have created a wonderful organizational culture because culture eats strategy. It's important we have a culture that has healthy behaviors as the norm or the default choice. We have so many culture and environmental supports, wellness programming throughout our university. You have so many options to engage in health and well-being at Ohio State. Stay alert for these opportunities and absolutely get engaged. We do a lot of fun activities like Amazing Race with teams. We can't wait to get past the pandemic to be able to start some of these wonderful team challenges again. We have resources galore to help you cope. We've got this wonderful website, go.osu.edu, just breathe. Just 5 deep breaths several times a day can really cut your stress, your anxiety, and lower your blood pressure. A program that I started several years ago now has become very popular at Ohio State. It's called Buckeye Wellness Innovator Program. We now have 700 faculty and staff working with me and my Buckeye Wellness team in the grassroots throughout our entire organization. These people are so critical in helping us to create this fabulous wellness culture. So please consider becoming a Buckeye Wellness Innovator. Reach out to me if you are interested. We also offer an energy management program in collaboration with Johnson & Johnson. Here you will see our own wonderful provost, Dr. Bruce McFerrin. He was one of our first leaders to go through this program. Urban Meyer has gone through the program. This program, if you're interested, is offered all year round. It will help you stay healthy, well, and improve your energy as well as sustain it throughout the day. Your Plan for Health offers wonderful online app programs to help with a variety of physical and mental health issues. So our dream of becoming the healthiest university on the planet has really begun to come true. We are the administrative home for the National Consortium for Building Healthy Academic Communities. This past year, the National Academy of Medicine's Action Collaborative on Clinician Well-Being, which I'm privileged to serve on that initiative, they highlighted us here at Ohio State as one of 2 organizations that are model organizations for wellness. So finally, I just want to make a charge. Ask all of you, what are you going to do in the next 30 days? What will you commit to really improve your own health and well-being. Here are the main wonderful, loving people in my life. When I don't feel like getting up in the morning and exercising or eating healthy, I put these 3 beautiful daughters in front of me, my husband, my 2 wonderful grandsons. I want to continue to be with them and be a part of their life. And to do that, I've got to do my part with self-care. One of the best days in my entire life was giving my daughter Kaylin, who you see on the slide, her vet school diploma last year in the shoe with the dean of the vet school. I didn't have a mom to see me graduate from high school, college, go on to have my 3 beautiful daughters and my family. I want you to lead a long, healthy life. I want you to know you can call on me and our wonderful wellness team at Ohio State University to help you in any way we can. Stay well and follow me on Twitter at Bernadette Melnyk for daily doses of inspiration and motivation. Thank you.